Hi, I'm Dr. Spence Jahner from Joint Repair Clinic in Montana. Today we're going to talk about what joints can we put cushioning in to help people get rid of their pain and their suffering and improve their quality of life. So we've had people that have come to us with joint pain, and when we've analyzed them, their joints aren't functioning right, and so they've requested that we put human umbilical cord tissue in their joints. And we've also learned that they've been diagnosed with meniscus tears and labral tears and soft tissue damage. And what's been a unique blessing is one of the side effects of putting umbilical cord tissue in people's joints for people that have had soft tissue and tears is that they feel, as a result of our procedures, that their joints are working better and functioning better than ever as a result of human umbilical cord tissue injected in their joints. So we've just been able to help many people with many different situations by injecting human umbilical cord tissue, recushioning their joints, and getting better range of motion in their joints. So what are the joints that we've been able to help people get recushioned in their bodies? Some of the main joints that we've had great success with are the knees and the shoulders. We've also had great success with people with their hips, with people with their backs. Being a chiropractor for 30 years, I was so grateful to realize that when people have cushioning gone in their backs, that when we put human umbilical cord tissue in their backs, that we can get cushioning back in their backs and improve their function in their backs as well. We've also had good success with people's feet, in their wrist, in their elbows. So it's just been such a blessing. Basically, any joint in the body that has cushioning, where the cushioning has degenerated or the joints don't function right or they lose range of motion in their joints, we've had success with putting umbilical cord tissue in their bodies and improving their lives. So when we talk about what ages of people can we help, there's really a huge spectrum. Now, very often younger people, we can do some of our treatments with the PRP and some of the other treatments that we have and get really good results. Very often, younger people can get healing without the use of human umbilical cord tissue. Now, if their joints are bad enough, the umbilical cord tissue may be the best thing that we have to offer, but very often younger people can use other treatments and have success. As far as what is too old, one of my favorite stories that I would recommend you all take some time to watch is go to YouTube and put in the name Hut Gibson, which is Mel Gibson, the actor Mel Gibson's dad. And he was 92 years old, and he had a bad hip. He had a lot of health problems, and he actually went down to Dr. Riordan's clinic down in Panama City, Panama. But he got umbilical cord tissue put in his hip, and he was in a wheelchair. He was 92 years old. And the doctors at Mayo Clinic down in Arizona highly advised that Mel Gibson and his family do not do umbilical cord tissue. But after the great doctor at Mayo Clinic in Arizona researched about umbilical cord tissue, he changed his mind. So one of the things that I want you all to listen to is, if your doctor is advising you against using human umbilical cord tissue, I would encourage you to ask them how much research they've done on human umbilical cord tissue, because it's not something that is taught in medical schools. And in Mel Gibson's dad's example, his doctor advised against it, and it wasn't that he was against it, it was just that he didn't know about it. And after he took some time to research it, he changed his mind and actually said what he got to lose. And Mel Gibson's dad at 92 went and had human umbilical cord tissue put in his joints. And as a result of it, he got out of his wheelchair. He celebrated, I know, his 100th birthday, and he enjoyed life for many years after 92. So as far as I'm concerned, there's no age too old to get better. So there's a great example of what you can do. One of the common questions we hear here at Joint Repair Clinic in Montana is, can you help me if the doctors told me I have bone on bone and that the only thing that I can do is surgery or replacement? The good answer is yes. We've looked at people that have been diagnosed with bone on bone, and very often people are told they have bone on bone, and when I look at their x-rays, there's clearly still a joint space in there, so it's not truly bone on bone. It's just a narrowing of the joint. And from my understanding, once the joint starts to narrow, a lot of doctors feel that's a valid reason to say bone on bone. But anyways, we have helped so many people that have been diagnosed with bone on bone by putting human umbilical cord tissue in their joints, along with the PRP, along with the nutrition, along with the ozone, along with the prolotherapy, along with the post-electromagnetic field table, along with the chiropractic care. We're getting really good results for people with bone on bone, as well as people that have had other joint conditions. So just because you get diagnosed as bone on bone does not mean it's the only one option for you. It's not just your only option is replacement. At least for the patients that have chose to go down our road, they're very happy that they chose to do something different. Or one of the testimonies that I'd like to share with you was one of our patients named Gene. And Gene came into us in a walker. He had already had a back surgery. And when he came in, he told us on a scale of 1 to 10, a 10 being living life awesome and a 0 being dead. He ranked his overall health or the situation with his joints at a 1. And here's a guy that loved to go to NASCAR races. Here's a guy that loved to go spend time with his grandkids. He had given up his season tickets for NASCAR. He had given up on the thought of traveling anymore to visit his grandkids. And he was very discouraged. One of the reasons why he was very discouraged is the doctors that did his back surgery said they would recommend doing a second back surgery, but because his health was so compromised, they were concerned he wouldn't live through a second back surgery. And so he came to us just asking if we thought there was any hope that we could do anything to help him out. I explained to him about all the procedures we do in our office, and he said, I at least want to give this a try. And it was so awesome to see the smile on his face when he returned months later without his walker, a smile on his face. And when I asked him the questions, how would you rank your health now, a 10 being awesome, a 0 being dead? He said, I would rank it at an 8. And he would recommend this to anybody that's looking for help with their joints. So it is so cool to see people that have been told, there's no more hope, that there's nothing more that can be done, or you have bone on bone, or, the only option is surgery. That isn't always the case. And if you're willing to research this and give this a chance, I think you'll find that many people are very happy with the decision. And really, that's what this is all about. It is so fun to hear from people that used to regret going downstairs, or walking down hills, or not being able to hike, or not being able to hunt or fish in the beautiful state of Montana, or ski or golf. Now people are getting their lives back, and something that they loved doing that they thought they'd have to give up forever because their joints were hurting so much. We're now seeing that when we get umbilical cord tissue in their joints and we recushion the joints, we improve their viscosity, we increase the range of motion, we get to see lots of smiles, and we want to see that smile on your face. So if any of this is hitting home with you or makes sense, or has at least got your interest, please reach out to us. We have clinics in Bozeman and Helena and Missoula and Billings. We also have a medical team that can answer questions for you. We have a lab that can answer questions for you. You can set up a one-on-one consultation with me over the phone or through Zoom or in person. We have a team that's here to make sure we give you the resources so you can make the best decision for you. But we just ask you to take some time and research this stuff. Take the knowledge and apply it. And if you use knowledge, I'm confident you'll make the right decision for you.